Let's talk about seeing what needs to be done and doing it about your baby. Well, obviously there are pleasurable things like getting some clothes and diapers and baby announcements and telling people and having a room and painting it. And even those things occur between conception and 12 weeks, without a doubt. But there's something else internally you need to pay attention to, which is your well-being and your baby's well-being. There is more likely, if your baby is having a problem, that you also don't feel as well as you would like to feel. So it's important you tell your birth provider if there's anything going on that you're uncertain about. There's a whole issue about anxiety that I'd like to share with you. And this is not what the dads talked about. This is what I've learned. If you are anxious about something and you're seeing it and you want to do something about it, ask yourself this first question. Do you feel that the problem is so severe that in the next 5 minutes it's going to be a catastrophe? If you feel that, for instance, if you start spotting, that's different than if you start heavy bleeding with cramps. So if you feel that what you are seeing requires you to get care, however you get care, then do that right away. Don't delay it. By doing that, you are learning how to pay attention to detail, see what needs to be done, and doing it. And those skills, as you hone them, will serve you and your baby well once your baby is born. If it isn't going to be a catastrophe in 5 minutes, ask yourself, is there likely to be a catastrophe within 12 hours? If there is, if you're seeing that, then if you feel you need to do something about it, seek appropriate help. And that's true if your baby gets a fever. If you look at that baby and say, I see that my baby is sick, and if there is a gut feeling in you that this baby is going to get sicker in 12 hours, then go get appropriate care. If neither the 5 minutes or the 12 hours triggers you in any way, then ask yourself, do I feel that something's going to happen that's in a negative in 2 or 3 days from now? If that's where you feel you are, it's okay to be anxious while you observe. That's seeing what needs to be done. And you're observing whether you need to do something about it. This is a great gift to give yourself, because if you honor the anxiety and observe, then you're more likely to either realize that it is getting worse and you need to do something about it, or it's getting better and you don't need to do something about it. Things don't stay static. They change all the time. So this is an important skill to develop within this skill of seeing what needs to be done and doing it towards your baby.